We begin with this developing story this hour. Pfizer's COVID-19 vaccine has been approved in the UK. This is the first country to do so. Rollout is expected from next week. Let's go live now to London, where our UK correspondent Olly Barrat will be joining us to give us an update. This is big news, Olly. How has it been received this morning?
I think it's being received with great excitement in most quarters. Certainly in government it is. It's been approved by the independent regulator here in the UK, the MHRA, so this is not something that government officials have been able to push through rapidly to try and get a win or a perceived success. This is something that had to go through those independent regulatory channels. A statement from the UK's Department of Health and Social Care saying that the government has accepted the recommendation from the MHRA to approve the COVID-19 vaccine of Pfizer-BioNTech for use. The statement says it follows months of rigorous clinical trials, a thorough analysis of the data by experts at the MHRA, and the statement goes on to say that those experts have concluded the vaccine has met its strict standards of safety, quality and effectiveness. And what that means is that this vaccine can now be rolled out in the UK within days. We expect that that will start, run by the National Health Service, as early as the start of next week. The UK had already ordered 40 million doses of this particular vaccine, and we understand that as many as 10 million of those doses are ready to go very rapidly indeed.
So the 10 million already in the system. 40 million, I understand, have been ordered by the UK. Now, this might be like an early Christmas present for the UK, for people who've been waiting for the vaccine. I understand it only provides up to 95% protection, but the independent regulator is satisfied that's good enough.
Certainly, and many vaccines for other diseases and viruses that are used frequently around the world have much lower efficacy than 95%. That is considered very high indeed, and certainly high enough to make a major difference when vaccinating a population. It's also worth saying that while Pfizer-BioNTech's vaccine has been approved, and that is a huge breakthrough, the UK the first to do it and the first therefore to start rolling this particular vaccine out, British scientists have been saying all along you will need more than one vaccine. You will need layer on layer of vaccine, and potentially for some time, to make sure that populations can be protected. So we are still looking to the MHRA for approval for the Oxford vaccine, for the Moderna vaccine as well. If you start to have 2 or 3 or 4, then populations will really be in a good place. The note of caution that officials are striking is that this vaccine, like some of the others, needs a couple of doses. So 40 million doses would vaccinate 20 million people. That is not the entire population. The other note of caution is that because you have to have 2 doses a few weeks apart, the effects of the vaccine will not start from day one of it going into your arm. So even those first people, healthcare workers, people in care homes, the most vulnerable, who are likely to receive this vaccine from as soon as next week, they won't suddenly be immune from COVID-19. So it doesn't mean that society, according to officials, can suddenly relax and stop social distancing and following the various tiered lockdown rules that are in place at the moment in the United Kingdom. But certainly the government very excited indeed about this, and very excited about what's been described by Boris Johnson as the cavalry coming over the hill now to try and move the UK and the rest of the world to the next phase of this crisis, let's say.
So the cavalry taking the first steps towards really recovery and dealing with this vaccine effectively. Have they listed who will be those high priority groups? You've mentioned the vulnerable, you've mentioned healthcare workers.
Yeah, so we've already had some indication from an organisation called the Joint Committee on Vaccinations and Immunisations. It's been putting together the list of priorities here in the UK for who gets the vaccine first. We have some sense of what that looks like. So healthcare workers, residents in care homes, those people who are more vulnerable to COVID-19 and its effects than other people, whether that be because they are older or because they have other vulnerabilities that make them make COVID-19 potentially more dangerous for them. So we will get the exact list and the exact order very soon indeed. The Department for Health and Social Care is saying that that the JCVI will shortly publish its final advice for the priority groups that will receive the vaccine, but it does say that will include care home residents, health and care staff, the elderly and the clinically extremely vulnerable. So it'll be people in those groups that we expect to start receiving the jab from as soon as next week.
Okay, you're going to need a couple of jabs before you can sort of really feel that you are safe. So the health authorities are stressing that even if you get those 2 jabs in the near future in the UK, you still have to maintain some of those strict COVID-19 protocols. Am I wrong?
That's right, but government officials have been holding out the possibility in recent days, and it's not clear at all how they will do this, that as vaccines do start to be taken up, then there might be a way of allowing people who have been vaccinated and have the certificate to prove that they have been, a bit more of a return to normality in their lives than people who have not. Now, that's a deeply controversial idea. As I say, not sure exactly how it would work. But bear in mind that already sections of the travel industry, for example, have said things like you can't get on our aeroplanes unless you can show that you've been vaccinated. That's not dissimilar from international travel in many ways already. To travel to certain countries, you have to show that you've had various jabs and booster jabs to make sure that you're not carrying anything or potentially able to pick something up while you are there. So it's things like that government officials are looking at to try and help ease a return to normality, but it's going to take some time. And Boris Johnson yesterday, while debating the new tiered restrictions that have come in the UK, in England from today, made it very clear that even with the vaccines being rolled out, he believes that through till spring of next year, so March, perhaps April, that restrictions are going to need to be in place in some form, and people are going to need to continue following those rules.
Yeah, it might not be a perfect Christmas gift for many people in the UK, but for many people who've been waiting for a vaccine and are ready to use it, this will certainly be welcome news with all those highlighted conditions and stuff like that. Will you take one? Will you take the vaccine, Olly?
I'll do what I'm told by people who are cleverer than me. And one thing that the government is stressing in all of this, Dan, is that this is an independent regulator. This is not something that government officials have been able to push hard for. They've handed this vaccine over to the independent regulator and asked them to do the studies. One thing that is worth pointing out, though, with regards to this question that you've asked me, is that the statement from the Department for Health and Social Care says to aid the success of the vaccination programme, it's vital everyone continues to play by their part and follow necessary restrictions. It also says that the NHS has decades of experience in delivering large-scale vaccination programmes. We also know that there's going to be a significant campaign here in the UK to convince people that this vaccine and others that come online are safe and important and should be taken. They are not going to be compulsory here in the UK, but certainly all efforts are going to be made to convince people who might be wavering at the moment that this is a safe vaccine. And you asked specifically about me. I'll take the advice of the experts, and my wife, who works in healthcare, I think will be encouraging me in that direction too.
And good luck to her, and good luck to you as well, Olly. Finally, I know it's early days, in terms of since this announcement has come out a couple of hours ago that the UK is the first country to approve the Pfizer COVID-19 vaccine. Reaction? Have you been able to say, what is the reaction, just very briefly, from other quarters around in the UK?
I think people are really excited. This is something that people have been waiting for some time. A huge praise is being given to the scientific community that have come up with this vaccine and others, and the scientists that have been studying this as well. The regulators have been working alongside these scientific organisations to make sure they have the data in real time and didn't have to wait too long after trials finished before they could evaluate them. Huge excitement now. One of the concerns, if there is one, is about whether the NHS is up to the rollout. This is a hugely complicated operation, not least because the Pfizer vaccine has difficulties in terms of storage and distribution. Is the NHS going to be up to that task? Government officials for now are saying yes, they believe it will be.
Olly Barrat, thank you very much as always. Live to us from London with a developing story in the UK. The UK announcing that it has become the first country in the world to approve the Pfizer vaccine, starting to roll out from next week with priority groups. It won't be compulsory, it will be voluntary, but there's all kinds of statements being made about people must still maintain those COVID-19 restrictions that exist.